set against the backdrop of Kuching and Kota Samarahan.
The culture here is welcoming. It is a big family. Everyone wants the next person to succeed together. We want our students to reflect back to the society and the community today. As a community-driven university, we believe that immersing themselves and ourselves in the diversity, it creates better innovation and greater creative achievement.
In Unimas, there's not a culture of a competition here, but a great environment is what we all strive for.
Everyone is committed to create a great environment to become a great doctor in the future.
Our patient population in Malaysia is remarkably diverse. Different languages and dialects will be something that we face every day once we become a doctor. So, getting to know this and learn it now make us to be more appreciate and respect. It just set us up to become a better doctor for the future.
From the beginning of the program, 25 years ago, we have adopted a spiral curriculum. As the students advance forward into their years of clinical study, we connect everything back to underlying basic biological sciences. We connect and revisit every aspect of human health, from emotions to diseases, back to its basic biological sciences.
We are introduced to clinical setting early in our curriculum. The exposure gets more as we advance through the year. It was very daunting at first, as a first-year student, to step into hospital and seeing patients. But at the same time, it's really an exciting experience.
We are committed to excel in nursing education, research and practice. It views health as a complex and dynamic and the client as a holistic individual. Students in this program learn in an environment that stimulates intellectual inquiry and creativity, which encourages them to be problem solvers and lifelong learners.
Here, we learn how to care, to serve and to help. We went from zero to hero.
I really cannot pick a better place to learn and become a greatness. This is a place that belongs to my heart throughout my journey.
Come do research with us.
Come and join us at Unimas and realize your dreams.
Good morning, Dr. Y.
Good morning.
Thank you for having us this morning to discuss about this back pain and neck pain.
Welcome.
Can you just give me an overview about this the scenario of back pain and neck pain that we have in the community at the moment?
Yeah, actually, back pain is a pain experienced at the back from the neck to the back region all the way around. So most of the people experience back pain in some point of their life. So it means that very common.
So how about in terms of like the prevalence of it?
Okay, for the prevalence rate, actually, over 80% of the population experience back pain. So it's very common, specifically 10 to 63% effect on the back region and 67% on the neck region. It also contributes to leading causes of the disability among the reproductive age group, especially in construction site of the workplace. Literally, back pain is number 1 cause of the disability and neck is number 4 cause. That's why for the purpose of the back pain management, we would like to share the medical knowledge, preventive and management of the back pain. So I want you to have the understanding of the structure of the neck and back region of our body first.
How about in our rehab center, how many cases that you have seen in relation to back and neck pain?
I have seen many cases, but this saying like the causes is different. Actually, we can divide into causes like structural base causes and the related causes of the other problem. Let's say structural base means like from the spine, bones of the spine, disc of the spine, muscle and other nerve lesions causes. So for the related disease mean other diseases can also give rise to the back pain.
Okay. So, in terms of like when you mentioned just now the cause of back pain, what are the risk factor or what that can cause a person to get this back pain or neck pain?
Basically, the most common one is the muscle sprain. So for these purposes, the patient have experience of like carrying heavy weight or some round posture using for the long period. So that is very common. Rather than that, we also have the other causes of the back pain. We have to do a physical examination and narrow down and search the causes of the back pain. That's very important.
Okay, in terms of like back pain, okay, in terms of like posture, what kind of, when you say about posture, what kind of posture that cause a person putting them at risk of getting back pain?
Okay, this I wanted to talk this much because in this COVID period, most of the people are stuck on the table and stuck on using computer for long period, for using of this computer. So most of the patient not awareness of their posture, whether wrong or right. Maybe they usually use the round postures for very long period, so that would make the muscle strain and sprain and cause the patient's back pain. That is one of the causes. So that's why we need to give the awareness of this posture to the people. That's why I just wanted to share my experience to them.
Okay, I see you have this model in front of you. Can you just show where is the most of the pain that person will experience in terms of like relation to posture?
Okay, basically, first of all, I wanted to share the knowledge of anatomical structure of the spine. As you see, in our spine is made out of small pieces of the bones that we call the vertebral body. So in between the vertebral bodies, we also have another structure, the clear one that we call the intervertebral disc. So around that structure, at the side of this structure, you can see there is the opening or window. So this window is called intervertebral foramen. Basically, in our vertebral column, at the vertebral column, at the back, there is the spinal cord here. The spinal cord is coming out from the brain. So from the spinal cord, some branches of the nerve coming out, passing through this window that we call the spinal nerve. So this spinal nerve is coming out from this foramen, Okay, so if there is narrowing of this foramen, so can compress to the nerve, that will make you back pain. And also, if it is serious one, can also have the muscle weak and loss of the function, then leading to get the disability. So that is the main causes of back pain area. But other causes, like some of the lesions in the vertebral body because of the diseases like tuberculosis of the bones, and some causes here, it is a joint, so some diseases like rheumatoid arthritis can give rise to the inflammation of this area, can also compress on this area, this spinal nerve. And also ankylosing spondylitis, also the round posture or position of the spine can also compress on the spinal nerve, and also affect on the other structure like ligaments. So most of the ligaments are attached to spinous process along the way, and also front of the vertebra and at back of the vertebra. So if there is diseases or inflammation of this ligament, also give rise back pain. That is the base of the structure produce the back pain.
Sometimes when we stand, I mean like in a long period of time standing, and then sometimes we sit, I mean like too long, and then it causes some kind of pain at the back, and then we usually don't really sure which part that pain come from, and then most sometimes we thought that is something like between the area of our kidney, and then we thought the pain is from there. So does that I mean like something like that indicating that is the actual place that the pain is, or the place that actually that causes us to get the sensation of that pain?
Okay, some kinds of pain is not because of the structure. They coming from the other structure near the vertebra. Let's say kidney. So kidney is located at the back region, here, at the lumbar region. So here is the kidney, location of the kidney. So if there is an inflammation of the kidney or diseases of kidney, can also refer pain to the back. So means that we also feel like the back pain, but not because of the spine, because of the structure related to the spine. So that's very important. Sometimes we can, that's why we need to differentiate the real causes of pain. Otherwise, we meet the mismanagement of the patient. That's important.
Okay. So meaning that we cannot just take for granted whatever the pain that we experience, and then we thought is basically relating to our back pain.
Yes, correct. So if you have experience of pain, so you need to see the doctor or consult the doctor first. It's safe for the patient.
Okay. So how about neck pain? Sometimes we do experience a different level of back pain, and then sometimes it really causes to have I mean like something like migraine, and then sometimes we can experience like headache. So what basically that cause that kind of pain?
Yeah, okay. So that's why I like to share the knowledge of the neck anatomy. So if you see the neck region, there is the cervical vertebra. We have the 7 cervical vertebra bone. So the difference between the lumbar and vertebra is there is more or less narrower spaces in the vertebral foramen, also most relatedly the vertebral artery here. So if there is something like osteoarthritis of the spine or spondylosis, so that is the narrowing of the bony spikes or narrowing of the intervertebral foramen here, and also the fusion of the some transverse process. So that will affect on the vertebral artery as well as the spinal nerve. So let's say that the position is normal like that. So the direction of the track of the spinal nerve and the artery is okay, correct, no obstruction or disruption. So if there is changes in the posture, is like more loration or more flexion posture, so the vertebral artery can kink, and also less blood supply to the brain. That's why patients sometimes have the migraine or one-sided headache, and also sometimes they can get the fainting effect or dizziness. That is because of the vertebral artery obstruction or kinking. So another one is the spinal nerve. So these spinal nerves coming out from the vertebra and they combine together, make a plexus. And coming out the branches, these branches work on our hands, arm, forearm, and hands. That's why you may have something like weakness of the hand, so that is sometimes related with the neck problem. That's why patient need to take care of the functions of the hands and upper limb. So we also examine and assess the neurological examination of this part for the management part of bill. Okay?
Right, okay. So meaning that so there's various causes that lead to the neck pain.
Yes.
Okay. So and then it can be like due to our posture. It can be due to some kind of lesion or compression that happen around the back of our neck.
Yes, true.
Right. Okay. So when come to that, when we have that kind of pain, so what should we do in order to prevent it to become even worse?
What kind of pain? I want to know first. What kind of pain?
Let's say I'm having a sprain on my neck, and then I cannot turn one of the side, and then I feel pain every time when I turn my neck to the one of the side. So what actually how I can manage that?
Okay, so first of all, you need to take rest. Why? Because of the nerve compression. Whenever the nerve compression for the protection effect that on the muscle around the neck area. So for protection of the pain, the muscle has present. That's why if you feel like stiffness or cannot move properly, that means you have the muscles present at the neck. Okay, if you take the rest, so the muscles present reduce, so at the time your pain usually reduce. But we need to know the causes. That's why you need to see the doctor and consultation with the doctor to search the actual cause of the neck pain.
From your experiencing patient at the rehab center, what kind of cause that lead to the neck pain?
Actually, in this center, we usually see the muscle causes because of the long period of the working on the table or using the computer. So because of the wrong posture, the muscle has actually have the strain or sprain. So that's why if the muscle is sprain or strain, we definitely have the pain. And if we examine the neck, we can feel the spasm of the muscle. That's why, so we give the advice to the patients, please take note your position and posture during the time of the walking period. The one at the recent time you need to take rest, and we are teaching the patients what is the good posture for you or what is the wrong posture. So if they follow this instruction, so the pain 50% of the pain relief. But
for those who just never have that kind of neck pain or back pain, what would you advise them in order to prevent to get this kind of the occurrences of back pain?
Okay, that means we usually realize the daily life activity of the people. So, as you know, in daily life activity, we usually wash our face, personal hygiene, and driving the car, and also carrying the things. So, for those purposes, we have the technique. Correct technique, so this technique to show the patient or to show the people so they can prevent this kind of pain. So one more thing is now we are in work from home period and the social distancing, so we usually we always use the electrical devices like handphone, so that's the problem. Because this overuse of the electrical devices definitely make neck pain.
Okay.
We have seen a lot of cases.
Okay, so meaning that how long that we should spend sitting in front of our laptop or our computer while sitting up over the table?
Okay, based on the ages, there's different in a different age group. For elderly patients, at least 30 minutes. For adult patients, 2 hours. So that is a different in the different individual based on their tolerance. But actually, need to take rest interval in between the work period.
I see. So would there be any kind of stretching or exercise that they can do just to just to release the stress that they put up on the neck or the back?
Actually, we have to teach the people so how to use the devices, which position need to use. So the devices, how to hold it. How many distance away from our eyes? These are the knowledge need to teach to the people. That definitely prevent this kind of problem as well as other problem like eyes problem.
Oh, I see. So meaning that when you hold your mobile phone, there should be some kind of distance from your eye and your hand, and then the distance that they put up, and then when you hold your handphone, sometimes it puts some strain to the arm as well.
Yes.
And the same thing goes to when you put up your PC, your personal computer. So the distance of your eye to the screen as well as to the keyboard also gives some kind of strain to the arm, and subsequently it will radiate to the back or the
neck. Yes, and also shoulder and arm and forearm. So that's why very important to teach to them, because if you usually use the handphone is like free like that, so that also strain on the muscle of the arm and forearm. That's why we definitely have like tennis elbow or other kinds of the tendinitis. So that's why I need to teach the correct technique, how to use the devices during work time.
I see. So what kind of the treatment that can help to manage back pain or neck pain?
Okay, basically if they complain with the back or neck pain, we need to assess them first to rule out the important causes of disease and disorder of the spine, like tubercular infectious cases, inflammatory cases, tumor cases. We need to clear out these important causes, and after that, so if we find out the causes of the muscle or the joint functional restriction, so we have to manage these things by using the physical modality or by means of the physiotherapy. So for the purpose of this physiotherapy, we usually use the heat therapy, cold therapy, ultrasound therapy. If necessary, we use stretching machine. So based on the case finding.
Okay, so different kind of
devices we
Devices for different kind of to manage the back and the pain, and sometimes we have to follow the location of the pain as well, right?
Yes, correct. That's why before going to treat, we need to take X-ray to the back and neck to rule out other important diseases or disorder.
Okay.
That's very important.
Right. And in our community, sometimes we used to self-manage our own leg pain and back pain. So we use different kind of these pitches that we can buy over the counter at the pharmacies, and then sometimes we also use some kind of this massage. What is your opinion regarding that?
If you have the pain or neck or back pain, so based on the severity, you need to assess yourself first. So if there is a serious one, so necessary to consult a doctor. If not serious one, you can also buy some painkiller or patch or some kinds of the light massage. You can do it yourself. But if you treat yourself for at least 5 or 1 week, so after the treatment of yourself for 5 days or 1 week, the pain not relief, so you definitely come to see the doctor.
Okay. So we still can treat ourselves.
Yeah, if there is a pain, is a mild degree pain.
Okay. Right. Okay. Okay. My last question is that so what would you advise to all our viewers in relation to back and neck pain?
So this one are based on the general principle of the management of the back and neck pain. First of all, we need to do the prevention first. That's why we will distribute the pamphlet or some guide sheets to the people working here. So what is the good technique to use the computer, how to carry the things, how to do the daily life activity effectively. So we distribute the pamphlet to our people, and then if they also use the position, the good position in the work, and also interval rest, and how to do the stretching exercise, how to do the strengthening exercise, how to manage your awareness, how to remind yourself, we teach to them and the practice themselves. So that will be effective for them to prevent back pain. If there is, even though if they have the pain, so we can manage by using our rehab center at our US center effectively. So most of the patients come here complaining the back pain because of the prolapse in the vertebral discs, also arthritis, spondylosis, so they relieve the pain. We have these kind of cases a lot.
Okay. So thank you again to you, Dr. Y, for sharing with us your experience in relation to back pain and neck pain, and then I think the viewers would take notes of your advice just now. Although it's something that our day-to-day activity, but still we have to be cautious, and then this will help us to prevent from getting this back pain and neck pain.
Yes, as you know, prevention is better than cure. That's why we more focus on the preventive aspect of this back and neck pain.
Okay, thank you.
Oke, selamat pagi, salam sejahtera. Nama saya Avoid Anak Bakat, Jurupulih Perubatan Fisioterapi di Universiti Malaysia Sarawak, Unimas. Oke, pada pagi ini saya ingin berkongsi cara perawatan sakit belakang yang biasa berlaku di kalangan masyarakat kita. Oke.
Saya Connie Dixon Juan, Jurupulih Perubatan Fisioterapi Fakulti Perubatan Universiti Malaysia Sarawak. Hari ini saya akan berkongsi dengan anda semua mengenai perawatan dan pengenalian untuk sakit leher atau tengkuk yang sering dialami oleh kita semua.
Okey, pada video kali ini kita akan mulakan dengan senaman regangan. Ini adalah salah satu contoh exercise yang common diberikan kepada pesakit yang mengalami sakit belakang. Okey, untuk exercise pertama ini dipanggil single knee to chest. Maksudnya satu kaki atau sebahagian kaki ini akan dibawa ke atas dada. Okey. Then suruh pesakit ataupun patient tahan keadaan kedudukan ini dalam masa 10 ke 15 saat. Okey. Finish. Lepas itu tukar balik ke bahagian kaki yang sebelah, lakukan benda yang sama dan ulang tahan selama 10 ke 15 saat. Okey. Finish. So exercise ini perlu dilakukan, perlu diulang untuk 10 kali untuk kaki sebelah dan 10 kaki dekat kaki sebelah. Okay. Then exercise ini perlu dilakukan dalam sehari paling-paling 2 ke 3 kali. Okay. Seterusnya untuk senaman kedua yang hampir sama dengan senaman pertama, cuma bezanya adalah patient ataupun pesakit akan disuruh untuk membengkok dua-dua belah lutut dan bawa ke bahagian dada. Okey. Tahan kedudukan ini dalam 10 hingga ke 15 saat. Okey. After finish 15 saat, kembalikan dalam keadaan relax balik. Okey. Dan ulang benda yang sama untuk 10 kali. Okey. Okey, exercise ini juga boleh dilakukan untuk setiap hari 3 kali sehari. Yang penting adalah terutama awal pagi. Okey. Dan kita terus proceedkan untuk senaman yang ketiga. Ini adalah senaman regangan untuk bahagian otot paha ataupun yang lebih dikenali sebagai hamstring. Dalam pos permulaan ini, sakit akan disuruh membengkok lutut, dan dalam keadaan ini suruh patient untuk meluruskan kaki. Okey. Dan tahan dalam 10 hingga 15 saat. After finish 10 hingga 15 saat, dan turun kembali kepada position asal. Ulang benda yang sama untuk kaki di sebelah. Okey. Okey. Then after finish 15 second, kembali ke bahagian asal. Rehatkan balik patient, and then suruh pesakit ulang benda yang sama, step yang sama sebanyak 10 kali kiraan. Untuk 10 kali repetition lah untuk kaki sebelah kanan dan kaki sebelah kiri. Okey. Semua senaman regangan ini perlu dilakukan setiap hari, paling-paling ataupun sekurang-kurangnya 2 ke 3 kali. Yang paling penting adalah ingat pada bahagian yang awal pagi, terutama sebelum bangun untuk memulakan pekerjaan. Okey. Okey, now kita teruskan balik. So kali ini saya lebih fokuskan kepada exercise untuk kuatkan otot, yang lebih dikenali sebagai strengthening exercise lah. Okey, dalam strengthening exercise ini saya fokus kepada 2 exercise. Exercise pertama adalah static abdominals. Okey. Sebelum melakukan exercise ini,
patient perlu dalam keadaan relax, bengkokkan lutut. Then salah satu tangan terapis, tangan saya harus berada di bahagian bawah belakang ke belakang patient lah, di bawah bahagian punggung. Then kita kena instruct patient untuk keraskan otot perut. Yes. Then kita kena tahan, suruh patient tahan dalam kedudukan ini untuk 10 ke 15 second. Once habis 15 second, patient perlu kembali ke relax ke bahagian asal balik. Then ulang benda yang sama untuk 10 ke 15 saat ataupun 10 ke 15 kali. Ulang benda yang sama untuk 10 ke 15 kali. Saya teruskan lagi dengan senaman kedua untuk strengthening exercise. Senaman kedua ini dipanggil pelvic bridging. So we just instruct pesakit untuk mengangkat badan punggung separas dada, dan tahan position ini ataupun tahan keadaan ini dalam 10 hingga 15 saat. Once habis 15 saat, kembalikan keadaan asal dan suruh patient relax. Ulang benda yang sama sebanyak 10 ke 15 kali. Up, lihat, hold, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then relax. So exercise ini adalah untuk menguatkan otot core, maksudnya otot-otot kecil yang menampung ataupun yang lebih menguatkan lagi bahagian belakang.
Bagi exercise ataupun senaman untuk leher kepada pesakit leher, senaman pertama merupakan senaman stretching ataupun regangan otot. Jadi senaman ini memerlukan beberapa pergerakan leher kita. Jadi yang pertama, pesakit akan menggunakan tangan dan mendongak ke atas, tahan selama 5 saat dan ulang selama 5 hingga 10 kali. Selepas itu, pesakit akan menggunakan tangan letak di belakang kepala, tunduk ke bawah, tahan 5 saat dan ulang sebanyak 10 kali, 5 hingga 10 kali. Seterusnya, pesakit akan memandang ke sebelah kiri, menggunakan tangan dan tolak sedikit, tahan selama 5 saat dan ulang 5 hingga 10 kali. Seterusnya, pesakit menggunakan tangan kiri dan pandang ke kanan, tahan 5 saat dan ulang 5 hingga 10 kali. Seterusnya, menggunakan tangan kanan dan simpan di sebelah sini, pesakit akan bergerak ke arah kanan dan tarik untuk membuat regangan di bahagian sebelah kiri. Tahan 5 saat dan ulang 5 hingga 10 kali. Seterusnya, pesakit akan diminta untuk mengambil tangan kiri dan tarik ke sebelah kiri dan tahan selama 5 saat, ulang 5 hingga 10 kali. Ini adalah untuk senaman regangan. Untuk senaman menguatkan otot leher seterusnya, kita boleh membuat satu senaman yang dinamakan active resisted exercise untuk bahagian leher. Jadi, selalunya jika anda pergi ke mana-mana rehab center ataupun mendapatkan perawatan untuk leher, kita ada satu benda ini. Benda ini dinamakan TheraBand. Dia mempunyai pelbagai warna kuning, merah ataupun hijau. Jadi ini adalah untuk contoh. Anda boleh, saya akan menyimpan TheraBand ini di dalam posisi ini. Selepas itu, saya akan memastikan pesakit dalam keadaan selesa, belakang pesakit lurus dengan kepala pesakit berada dalam keadaan ini. Jadi, saya akan memberi arahan untuk pesakit menggerakkan kepala ke depan, dan saya akan memberi tekanan sedikit di bahagian sini dan memberi arahan kepada pesakit untuk melawan pergerakan ini. Tahan selama 5 saat, 1, 2, 3, 4, 5 dan relax. Kita boleh ulang sekali lagi. Tahan 1, 2, 3, 4, 5. Pergerakan ini boleh dilakukan sebanyak 5 sehingga 10 kali. Ini adalah untuk menguatkan otot di bahagian leher, terutamanya di bahagian belakang, dan otot yang berfungsi untuk pergerakan ke depan kepala kita. So mungkin tidak semua tempat akan ada TheraBand ini. Jadi selain daripada exercise menggunakan TheraBand ini, kita boleh menyuruh pesakit untuk meletakkan tangan di bahagian dahi. Selepas itu memberi arahan kepada pesakit untuk menggerakkan kepala ke depan melawan tangan yang berada di dahi. Tahan selama 5 saat dan boleh ulang 5 hingga 10 kali. Jadi semasa pesakit melakukan pergerakan ini, Anda akan dapat melihat otot di bahagian leher dan di belakang, terutamanya di bahagian leher di depan atau di tepi ini, akan berada dalam keadaan tegang ataupun boleh menguatkan lagi otot di bahagian leher ini. Dari perkongsian yang kami kongsikan sebentar tadi, jadi seperti yang kita sedia maklum, sakit belakang dan sakit leher ini sebenarnya disebabkan oleh beberapa faktor ataupun beberapa tabiat yang tidak betul yang kita lakukan setiap hari. Sebagai contoh, posture atau posisi badan memainkan peranan yang sangat penting untuk menjaga kesehatan belakang kita.
So, exercise yang saya ajar tadi itu boleh menjadi sedikit tips untuk kita orang gunakan di rumah. At least dapat membantu kita orang di luar yang mengalami masalah sakit belakang.
Jadi terakhir kepada saya cuma ingin nasihatkan kepada anda yang berada di luar sana, jika anda merasa mempunyai tanda-tanda sakit leher ataupun sakit belakang, cepat-cepatlah berjumpa dengan doktor dan ahli fisioterapi untuk mendapatkan perawatan yang lebih lanjut, kerana jika anda merawatnya dengan segera, maka kita berharap kesakitan itu mungkin dapat dikurangkan dan boleh pulih secepat mungkin kerana jika anda tunggu makin lama, dia akan makin parah. Jadi akan mengganggu activities of daily living jadi tak berdiri, tak boleh jalan jauh tak boleh, travelling lama dan kereta pun semua tak boleh. Jadi semua itu akan menyusahkan kehidupan hari anda. Jadi itu sahaja daripada kami bertiga. Semoga video ini yang kami telah buat dapat memberi sedikit sebanyak informasi lah, dan menambahkan pengetahuan anda di luar sana. Jadi itu saja, sekian. Terima kasih.